Good morning. I'm Dina DiOrio, Mecklenburg County Manager. I want to compliance we get, the quicker we can get through this. And so again, we appreciate all of your cooperation. I'm joined today by Gibbie Harris, our Public Health Director, Fire Chief Johnson, who will provide an update from the EOC, and Deputy Chief Jeff Estes from CMPD, who will provide an update on enforcement activities. Just to give you a little bit of information around county services continue for the most part. The vast majority of them are online. We are probably now, as a county government, 80% virtual, but those services do continue. Our parks are open, our greenways are open, our boat ramps are open. We have provided more guidance around golf. We were getting a lot of questions around golf, and so that information is now available. What we're saying is that if you want to have golf, you can have one person in a cart at a time and only one person in the pro shop at a time, and we believe that will help provide the social distancing that is necessary, but still provide people the opportunity to play golf. A couple other things: we are consolidating operations at our public health clinics. The Northeast Health Clinic on Beattysport Road will be closing, and all of those services will Southeast. The one on Billingsley Road will remain open. Or is it the other way around? Other way around. Okay, sorry about that. The one on Billingsley Road will be closed, and the one on Beattysport Road will remain open. So I apologize for that little bit of confusion. The other thing we want to remind people is that our child abuse and neglect report line is still open. That number is 980-314-7700. Please, we want people to be safe, even though kids are home and all of that. So please know that that information is available and that people should report any cases that they believe are abuse or neglect, as well as human trafficking. And so we want to make sure that those enforcement activities continue. On mecnc.gov/COVID-19, people can find a complete list of service changes. We are updating that every time that we have had a service change, so please go there to get that. The other thing I just want to say is you've probably noticed that since Mecklenburg County adopted its stay-at-home proclamation, we see a lot of other surrounding counties following our lead. We think that's important because of the transient nature of our populations between us and the surrounding counties. The fact that we're all going to be working together, working under similar circumstances, we think will help assist in reducing the number of cases that we end up getting here in Mecklenburg County. The call center for interpretations of the proclamation is still open, 8 a.m. to 8 p.m., 704-353-1926. We encourage people to continue to call and ask questions. The more information that we get through those questions helps us provide additional guidance on how the order should be interpreted. And so we appreciate the feedback that we've been getting from people, and we encourage that to continue. In addition, if you see complaints or you see businesses that you think are not in compliance with the order, we're asking people to report those to 311. And at this time, I'll turn it over to Gibbie Harris for an update on the public health side. Thank you.
As of today, this morning at 11 o'clock, we have 259 total cases in Mecklenburg County. That's up from 204 this time yesterday. I want to address the issue of testing. It has been a contentious issue since the beginning of the first case in the United States. It continues to be a challenge for our country and for us locally in terms of making sure that we have the capacity and that we're testing the people that really need to be tested. What we do know is that our capacity throughout the testing process is still limited. So from start to finish, when a test is taken to the time that it is processed, we continue to have some capacity issues. That has been resulting in delays in receiving some test results, and we fully understand the frustration that individuals are feeling about that. Of those being tested, we know that our numbers are increasing more rapidly every day. And we also know that we have community spread across the entire county. All ages are being affected, all areas of our county. As the capacity to test continues to increase, but not enough to test anyone who wants a test. We continue to do widespread testing. We continue not to do widespread testing at this point. We need to assure that tests are available for those who are most at risk, including our first responders, as well as our healthcare workers. This presents a challenge in determining the true extent of this infection in our community. We recognize the fact that the 259 who have tested positive is a smaller number than what we're actually seeing here in Mecklenburg County. The guidance from the CDC and the state on testing is to limit testing to those who are most at risk. They are recommending that those with mild symptoms stay at home. And if you have concerns or issues, to contact your physician, your urgent care, or the health department for clarification on this, but to do it by phone, not in person. In Mecklenburg County, we're also asking everyone who thinks they may need to be tested to use the call-in numbers that are available to them. There are two, both of the hospital systems have telephone numbers on their website. We want you to be virtually screened before you show up for testing. This will help us make sure that the testing is available to those who are in need, but it also will help us prevent the unnecessary use of protective equipment for our providers. Again, virtual assessment is critical. Our data as of yesterday afternoon, which does not include positives reported for today, shows that nearly half of the reported cases were adults between the ages of 20 and 39. We still only have 2 cases in youth under 19. Our demographics have not changed. About 1 in 5 reported cases have been hospitalized at some point in their illness due to their COVID-19 infection. And 1 in 10 reported cases have been released from isolation. So we do know that people are recovering from this and are able to go back to work if they're essential and to interact with others. We know that our hospitals are seeing a steady increase in cases and admissions, but we're also seeing improvement in turnaround time and test results. We're hoping that will continue. We will no longer be providing the map that we initially provided because what we're seeing is widespread infection in this community. We don't want people to think because there are smaller numbers in a particular zip code that it's safer to go there and to interact with others. People need to recognize that we have widespread infection in this community. They need to do what we've asked them to do in terms of protecting themselves and making sure that they're not exposing others. I want to reaffirm what Manager Diorio said about the order. We need everyone to comply with the order, not to attempt to figure out what the loopholes are in the order so that they can do what they'd like to do. We know how difficult this is. I think a number of you have seen that it's difficult for me. I just pushed my glasses up. I've got my hands behind my back trying to keep my hands away from my face. It's a hard habit to break. But we need everyone complying with all of the orders that are in that proclamation, because that is what's going to help us reduce the spread in this community and hopefully prevent us from seeing what other places in the country are seeing right now, which has been devastating to those communities, not just from an economic standpoint, but from the number of deaths they're seeing as well as the number of people infected. So just please be part of the solution and work with us on this. We greatly appreciate it. Thank you.
Good morning. The Charlotte-Mecklenburg Emergency Management Emergency Operations Center has been open for well over 2 weeks. We have representatives from city, town, and county representing their departments. We also have CMS and representatives from Novant, Atrium, as well as nonprofit organizations. We continue to work to coordinate our response to this pandemic here in the county. Our call center, as already mentioned, is open from 8 a.m. to 8 p.m. Monday through Friday. We had significant call volume early on in the week. It has slowed, but we encourage you to call that number. Again, the number is 704-353-8255. 1926. This way, we're able to get you a centralized, consistent answer to the questions you may have regarding the stay-at-home order. We're also collecting information on volunteers, those that wish to volunteer here in the county. That number is 704-432-4127. We're capturing anyone that wants to volunteer as well as donate anything to the response to this particular situation. Within the coming days, we hope to have a website up and running that will actually help in capturing that information. We will have that information out through our joint information center as soon as that is up and running and stable. The state is also wishing to capture information about healthcare providers that wish to volunteer. You could go to the North Carolina Emergency Management website and to volunteer and to give your contact information for that purpose. We will have that on the Mecklenburg County website later on today, or you can, like I said, go to the North Carolina Emergency Management website. We are here to provide support to the county for the stay-at-home order. We are in full support of trying to flatten the curve from this pandemic. So please, again, as Ms. Harris has stated, do not try to find a loophole. Let's make sure that we follow the rules as intended. Right now, I'm going to have Deputy Chief Jeff Estes come on up from CMPD. Thank you.
Thank you, Chief Johnson. We also want to echo our admiration and the leadership from the emergency management, everyone in the Charlotte-Mecklenburg area across the county for their reaction and leadership during this pandemic. From the CPD's perspective, a couple of things. One, as far as enforcement goes, we are very pleased at what we've seen so far from all Mecklenburg County residents. Most people are doing the right thing. Those that aren't, I think you know who you are. We encourage you to do so. Second is that we have reached all across the county. All our enforcement agencies are on the same sheet of music, enforcing the order in the way that we have outlined early on, which is on a platform of education and dialogue to ensure people know who can be out and who can't on a broad platform. If so far we've received about 12